Today we have Dr. Rebecca George on the podcast. She's a licensed naturopathic doctor at the Family Clinic of Natural Medicine in the Madison area, graduating summa cum laude from the College of Naturopathic Medicine at the University of Bridgeport. Her certifications include training in craniosacral therapy and first-line therapy. Dr. George's particular areas of interest are women's health, autoimmune and inflammatory conditions, GI disorders, food allergies, and sensitivities. She has a lot of knowledge on a lot of different topics, and we're super excited to have her on here today. Dr. Georgia, welcome to the podcast.
Yeah, thank you. Thanks for having me. Happy to be here.
Absolutely. So, we were talking kind of before we started recording about how we do have a lot of, similarities in terms of our philosophies as well. And you can speak on things a little bit deeper too, because of your knowledge base. And we're excited to get into that as well. So I think it's important for people to understand your background too, because the reason why you are a naturopathic doctor is because it literally helped save you in many ways. It helped heal you. And I want you to talk to the listeners about how specifically it helped you. So obviously, growing up, you were suffering from a lot of challenges, in terms of your body. So why don't we just, I won't spoil it for them. Why don't we kind of have you tell the background on kind of what you were struggling with growing up and how you were able to overcome it?
Yeah. So, most of my life, I've actually was really, really healthy. And then my senior year of high school, so I played basketball my whole life. That was kind of like my mini little passion. And my senior year, actually, during basketball practice, I started having a ton of ankle pain, and it was just different. It wasn't like just, I didn't sprain my ankles. I know what that feels like. It was just awkward, and I just kind of brushed it off. But my ankles were kind of swelling and turning black and blue a little bit after every practice. And I started having to ice my ankles. I'm like, what is going on here? Basically, I ended up, I was at the clinic because I had to do a physical because I thought I was going to be a dentist. So I had to get this pre-dental workup to do a work study program. So I was there, and I mentioned to this doctor, and I'm like, hey, something is, I think, can you just look at my ankles? Is this weird to you? And they took a look, and they did some mini neurological tests, mini little whatever workup, and they're like, and they're like, that's awkward. And I'm like, yeah, I know it's awkward. So I got referred to physical therapy because I was an athlete, so that makes logical sense to them to, it must be a sports injury. So ended up going to physical therapy. They didn't know what to do with me. Ended up going to neurologists because they thought maybe something was wrong neurological. I got tossed around quite a bit. So, my basketball season is dwindling away as this time goes on, because we know nothing happens fast. It was a little faster maybe back then. But basically, I remember I was at home one night on the computer, and there wasn't a lot of medical stuff to look up back then. I think it was like WebMD or Mayo Clinic, and not very much. No fun blogs or anything like that. So, I looked it up, and I came across rheumatoid arthritis, and I was like, this sounds a lot like what I'm experiencing. And then I called my parents into the room and said, hey, have you guys ever heard of this? What do you think of this? And they're like, oh, by the way, your older cousin, who's a good amount older than me, so we don't know each other very well, has it. And I was like, that's interesting. So, I had to go back to the doctor. I presented them could I have rheumatoid arthritis? And they're like, oh, that's a good idea. Let's maybe test you and send you. And anyway, it ended up being a back and forth rigmarole of doctors saying, maybe not. Oh, wait, you're not positive. Oh, it called me 2 weeks later. Never mind, your tests were positive. It was crazy. I see this all the time with my patients that are in similar situations. No one's giving you a good answer. You're just sitting there waiting, have no idea what to do. Basically, long story short, I got diagnosed with rheumatoid arthritis. I also developed dry eye, which some say was Sjogren's, some say was not. I had eczema started appearing all over my legs, which was super awkward. And I also got Raynaud's phenomena, which is like, it was more in my toes at that time, but they would turn pure white being exposed to cold, and they felt like frostbite. So I had all this happen at once, and I'm like, what the heck is going on? But little did I know, which know so much more now, is when I got that label, then I just started having to be on the role of being on a lot of meds. So, I got started off on here, take Vioxx, which is off the market now because of, I think it was killing people. So, I mean, I went on that. I went on hydroxychloroquine, and then they didn't know what else to do. So I was on steroids for a year and a half straight, which they don't do that anymore. I had gained like 30 pounds on that. So that was also not a very fun experience to deal with. And then I ended up being stuck on methotrexate for quite a long time. And that's a low-dose chemotherapy type of agent. They use it a lot for autoimmune, but basically, I mean, it kills like rapid producing cells still, like chemo does. So I mean, then I started losing a little bit of hair, nothing that a woman wants in their senior year or first year or second year or any year of college or their life. So I've definitely been through that craziness, and I still was in pain. Like I still was having swollen ankles. My hands started getting affected. I couldn't play my whole senior year. I went to every single practice and every single game, but because by the time they figured out what was wrong, and by the time I got on Met, like the season was over. So, I mean, that was kind of a mental stressor, but I'm over that now. But like it hurt a lot as a kid. And then I just suffered through it in college, just trying to do good in school, trying to, I worked a lot. I'm kind of a type A personality, so I didn't let anything hold me back. I was working like 40 hours a week and throughout all of college, which is a little crazy. But eventually I just kind of like, I don't know what else to do. I'm just taking meds. I can't complain to the doctor anymore that I hurt, because all they want to do is add me on the next class of drugs. And I was kind of done. I'm like, I'll just stay where I'm at. I'll deal with this pain I had to ice my ankles every day for a whole year, my freshman year of college. And eventually, I don't know what happened, but I did actually start getting minorly better. There were still things I couldn't run. Not that I was a big runner, but I mean, I couldn't do any jogging. I couldn't even do that activity. I could walk, but I couldn't do any aggressive activity because my ankles wouldn't do it. Every morning in my freshman year of college, when we had alarm clocks, no phones at that point that had alarms. And though my alarm clock had to be way across the room, because that's how the outlet in our bunk beds work, I would fall every morning because of stiffness, because I had to sleep on the lower bunk, all these things that I was compromising and I just dealt with. Then basically, I was working at a grocery store, because I've done a grocery store thing my whole life. And there was a possibility that I could run the health foods department. It was a brand new department. And I was like, ooh, this is right up my alley, because I love health. Again, thought I was going to be a dentist. I basically helped them diagnose my own autoimmune condition. And I was like, yeah, I'll run the health food store. This is cool. I can learn more about and start eating more organic. And this was just all up and coming. It was pretty new. And I will remember this person shopping, and I was stocking the shelves, and we were just talking, and she was asking about gluten-free stuff. And at that point in time, I only know gluten-free for celiac individuals. That's what I was educated to. Had no idea what that was. I just know my job was to make sure we had gluten-free products stocked for those individuals who had celiac. And I'm like, got it. This is fun. But then this lady came and she goes, yeah, do you have this gluten-free, whatever brand she named? And we just started chatting. And she's like, yeah, I eat gluten-free because it helps my arthritis. And I was like, well, that's crazy. That's a crazy, that's crazy. Who eats gluten? I've never heard of this. Come on, I've been living with this chronic condition. I've never heard of this. It can't be true. It sat in the back of my head and I still didn't believe it. It took me a while to maybe believe that was a connection. But I loved being in the health food store, and I actually debated, do I just quit trying to pursue a medical career and do I just work at a health food store because it was fun? But I don't I needed more. I love helping people. I love digging deeper. So I knew I needed more than just that. But honestly, that has helped me a lot in my practice too. But I ended up applying to dental school. I ended up applying to naturopathic school. I got on the wait list at dental school and I got into naturopathic school. I had no idea what I was really doing with naturopathic school. Like I toured it and I'm like, I have no idea what this program exactly is about, but it sounded perfect. And I'm like, I want to learn how to teach people how to eat. I want to learn how to help myself. All these chronic conditions and diseases that are out there, it can't just be you're on a pill for the rest of your life and suffer the side effects. And like this couldn't like I'm like, this can't be the rest of my life. So basically went to naturopathic school and I like did everything I possibly could. I was still on meds and I went to chiropractic, massage, naturopathic. I'm like, do what you need me to do, I will do it. I want to get off meds, I want to have kids down the road. Let's make me as healthy as I can be, because I didn't feel super unhealthy, but I was not like, I was a high energy person, and I definitely had a good chunk of 7 years where I would say I was at my worst health. I feel way better now than I did all throughout, my 20s basically. So lo and behold, I did a bunch of things, changed a bunch of things, took supplements, worked on myself, handled stress, started doing everything you can kind of imagine, went off my medication, did okay, did fine. I mean, I had no, I was waiting for the, ball to drop, but it didn't. And yeah, I'm just like, wow, is this too good to be true? I mean, eczema was gone. Raynaud's took the longest to go away. It went away for a couple of years. I'll say it's back, which kind of makes me upset, but I'm working on that, trying to figure out what's the cause of that. But doing good. I ran a 5-mile race like 9 months after my son was born, to just prove to myself that I can run, because I couldn't run before. So that was cool. I've done some mini sprint triathlons. Eventually I'm going to do a little more, but like it was just a box to check off my list. Like I don't need to prove anything more. It's just kind of like, yes, I can, my body works again. So It's kind of cool.
Wow. I mean, quite the story, right? Obviously a very early onset of rheumatoid arthritis when you're a senior in high school. I mean, usually right now to at least like the 30s or 40s at the earliest. And you're seeing that at a very young age. So I imagine obviously that was very difficult for you to go through, being a big time athlete growing up and not being able to do a lot of the things that you wanted to be able to do. And then, just by kind of your own research and figuring things out, you learned about naturopathic medicine. And now obviously it is what you do and what you help people with. So obviously you firsthand experience the benefits of doing things more the natural way versus being on medications. So you have also used that to help your own family member as well. Your daughter had food allergies, and I know that you've created a YouTube channel around this as well, at an early age, and you were able to help her naturally as well. Can you take us through that?
Yeah. So I basically, when my daughter was born, I could tell something wasn't right because she was getting a lot of eczema, and I was like, okay, must be, must need to clean up my diet, kind of like need to get myself healthier, maybe something. It was natural birth. Everything was great with pregnancy, great, whatever. And because I have a lot of knowledge and I can test a lot of things. Basically, we decided to test my daughter for food allergies, which is not super common. I even talked with a medical doctor that I know well, and she's like, it would be weird if it is, but it could be. And I'm like, yep. So we collaborated a little bit, and sure enough, my daughter came up with a ton of food allergies, and I see this story all the time in clinic too. She didn't have ear infections. She wasn't colicky. Happy baby, just full of eczema and didn't really get better with my diet when I was nursing. But basically, I'm like, all right, I can do this. So, I mean, I had to strictly go off all the foods she was reacting to. I still nursed for 2 years, which probably helped, but that was stressful too. Eliminating a lot of food with not a lot of choice at that point, but that's okay. And then she's grown out of a lot of allergies. All that remains right now is peanut and dairy. And there's a genetic family history of food allergies too. So, I mean, that piece, maybe it just fell in our genetics, but I mean, I think just me and my knowledge, like I'm so happy for what I knew. And again, there's a lot of reasons that I love what I do and I appreciate my education, but I don't think I would have diagnosed my daughter as soon. I don't think she would be as healthy as she is this day. She's never had an antibiotic. She actually says if she ever grows out of dairy, she still wants to be dairy free. Like she like embraces it. It's so she's actually very inspiring. And I sometimes use her with my patients too, of diet changing. Like, man, if she could be a spokesperson, she'll be like, it's okay. Like, mom, I'll go on vacation. I'll just eat, fruit and eggs every day and I'll be fine. I don't need to eat all that other stuff. Like, what kid is happy to give up all those treats and desserts? And she's just totally cool with it.
I mean, obviously a living proof right there of the knowledge you use for her, and right at such a young age, being willing to make all those changes for her health. So allergies are something that doesn't get talked about a lot, right? I mean, kind of in the mainstream. So how do you identify, or even someone listening, if they have a child or they might have allergies themselves, like how would you even start to identify an allergy being a potential root cause?
So, I mean, and there is a difference between allergy and sensitivity, and sometimes they have underlying things, but there's different ways to address and different severity. I mean, I think to me, any child that is classically, I would say colicky or has eczema, crying at night, itching, that's classic. You should rule out a food allergy, but they don't do that mainstream. They'll just say put hydrocortisone cream on and just deal with it. But there's something wrong. Like, your child shouldn't cry. I mean, my daughter didn't, which again was kind of different, but like, your kids shouldn't be having all these skin reactions. Something's going on in the gut if their skin is not good. And I could even argue that for an adult that has a bunch of skin stuff. I had an adult that came to me a few months ago, and we were talking about allergies, and her main complaint was just some sinus congestion. And she goes, by the way, when I was a child, I don't know if it was a dairy allergy or what it was. She's like, but I grew out of that. And I'm like, we're going to test your food allergy. She's like, but I don't have symptoms. Like, I was getting hives before when I was a child. I don't have hives anymore. And I'm like, okay, we're still going to test your food just to see. And it came back on an IgE test. That's the anaphylactic allergy test. And it came up mild. It wasn't super crazy high. Like, no one would get too excited, but it came up mild. And I said, avoid dairy. Tell me how you are in like 3 days. She avoided it. And she's like, oh my gosh, night and day different. All that congestion and fogginess I was feeling is completely gone. And she's like, I thought I grew out of my dairy allergy. She's like, I didn't know allergies could give me just mild symptoms. And I'm like, of course they can. Think of the environment. When people are allergic to dust or cats or grass, like, some people just have a runny nose. Some people can't go outside without suffering horrifically. Some people need medication. Some people don't. Like, there's such a whole big scope. People only think food is going to cause their throat to close up. And there's nothing, it's either that or nothing, which I think is a big problem, that there's always a scope of everything.
What are some of the most common allergies that you see in people when you test?
So if we're talking, I'll talk food allergies and food sensitivities, because again, there's a difference. But classic food allergies, especially as a kid, peanut, tree nuts, those are really popular. Eggs, dairy, those are probably some of the top. Once in a while, you'll see like soy. Once in a while, you'll see wheat. Usually a doctor or an allergist, or we'll test them at our clinic. They test probably about 10 to 12. My daughter also had a mustard allergy, which is really strange, but I gave her mustard. her lips tripled in size. Then we followed up with a test and made sure I wasn't completely crazy. And it was an allergy. She outgrew that, but super strange, right? Mustard, only it's vinegar, turmeric, and mustard, but still reacted to mustard seed. From a food sensitivity point, the top are gluten, dairy, and eggs, which sometimes they overlap, but those are going to be a little bit more generic when a person has just more of a sensitivity versus like, I need an EpiPen or I need Benadryl kind of allergy.
Right, right. Thanks for sharing all those. So what you just kind of brought up there was thinking of things that we wouldn't even think about potentially in general, like normal medicine, right? That you go through in naturopathic medicine with people, is testing people on different things like that. Like you gave the example, the person with dairy, like went off dairy for 3 days and all of a sudden feels completely different. So what are some, I mean, aside from even just allergy or sensitivity tests, like what are some other common tests that you will give people that aren't given in like traditional medicine?
Yeah, so I try to think outside the box. Like I love coming up with lab ideas. I'm kind of, sometimes I could be a little lab heavy at times just because I like finding data. I'm very science and very data driven. Um, I mean, we'll say if a person, for instance, comes in and they're just like, I can't lose weight, I've tried everything. I mean, there's definitely a diet and lifestyle component, but I will still walk through and say, okay, let's think of some tests that maybe no one has ruled out for you to see if there's something like internal metabolically going on. So I'll test a deeper thyroid panel. So not just the classic TSH, but I'll test free T3, free T4, thyroid antibodies, just making sure that the thyroid is fully okay and it's doing fine. Because if it's not, your metabolism is not going to be great. I'll also test like a blood sugar panel. I'm actually getting a little bit more into like continuous glucose monitors and just like people like understanding when they eat food, how their blood sugar reacts, how do they feel, how's their mood, how's their energy. And there's so much component to that. I think it's a really cool idea. So we'll test fasting insulin. I mean, some classic blood sugar stuff, but a doctor doesn't always even test hemoglobin A1C, which is a 3-month blood sugar average. It's not the best test, but it's still something. If you're on the high side, you're obviously having some sugar spikes. Is it because you're eating bad or is it because your body's not working with the sugar? We'll test female hormones, perimenopausal women. I mean, that's a huge chunk of, I think, both of our populations. And when hormones are going kind of crazy, metabolism changes, and you could be metabolizing great one day and then horrible the next week, and like that's
If you
chaos
don't mind
already.
my interjecting here, I appreciate you bringing that up. So how specifically do hormones, just so people can understand, like hormonal changes obviously in women are very rampant, especially as you enter into that perimenopausal phase. So what specific hormones impact metabolism? How specifically do they impact metabolism?
So my general rule of thumb that I always tell everyone is things need to be in balance. And it's when anything is out of balance, that's when chaos happens. And perimenopausal time is where a woman's eggs are decreasing. So your body doesn't ovulate every month, or you might have a month where your estrogen ramps up super, super high to try to get you to ovulate, but then nothing ever happens. So then you have estrogen dominance, and that can feel horrible. The first hormone that usually gets disrupted is progesterone, but too much progesterone also causes problems. Like, people always get really excited and they're like, oh my gosh, I need testosterone, or oh my gosh, I need progesterone. And the key really is you want your hormones balanced. Many times people are getting a lot of information out there of saying, oh, in order to build muscle, I need testosterone. And I'm like, I can see women with hardly any testosterone still be really lean. You don't need whopping high doses of this stuff it's about balance. If you're a really skinny, thin person, your testosterone is not going to be through the roof, and neither is your estrogen, and neither is your progesterone. But you can start gaining weight all of a sudden if your estrogen is slightly higher than your progesterone, or your testosterone is slightly higher or lower. It's really about balance.
Love that. So let's say someone comes to you and you can tell that their levels are out of balance. How do you go about, so again, in traditional medicine, we might see people treated with certain medications. How do you go about treating someone with a hormonal imbalance? Obviously, I'm sure it depends on the specific imbalance, but kind of give us your overall philosophy on treating that.
Yeah, I kind of I will say I have a wide scope because everyone's different and some people want different things. So sometimes I just educate a person of what's going on and why they're feeling the way they're feeling. And I'll have a lot of women say, huh, okay, you know what? I'm cool with this. Like eventually it's going to stop. It's a little crazy. It's not bad, but I'll just embrace it and move forward. And I think that's a cool idea too, because guess what? It's going to happen to us, to all of us women eventually. And everyone has different severities. So sometimes I'll just be super supportive and say, hey, make sure you're getting your B vitamins. Let's make sure, you know, you're processing and detoxifying fine. Let's make sure you're moving your body. And sometimes we're just super simple. Other people, and again, it depends their ages. I mean, if they're really, really getting close to menopause, it becomes a lot more difficult because I can't use their like eggs to help them. So sometimes we can use certain supplements to boost egg quality or to boost ovulation, but that's not going to work in like an upper 40-year-old because I can't make your eggs much better because you probably don't have much left. And it's just like our skin. You know, I wish our skin looked like a 20-year-old when you're 50, but it doesn't. We have an aging process and our eggs age as well. So being the healthiest you can be at a young age to maintain that egg quality is a great idea. And I know it never talks like that, but really, like when we're trying to be healthy as women, we're making our eggs healthy too by eating right, by exercising, by sleeping. Whole other topic, but sometimes I eventually use bioidentical hormones. So we have a medical doctor on staff, so I can prescribe. Not everyone gets bioidenticals. I'm pretty I like to talk a person through it. I like a person to make a good decision. Some people are better candidates than others. And if anything, we would do like a progesterone to start is the most common because that's the thing that decreases. But sometimes we can play with herbs. So it again kind of depends. Wide variety of treatment options, basically.
Right. So you use a lot of alternative modalities around, supplements, herbs, functional lab testing, diet and lifestyle changes to find underlying causes of disease. So what are some of those what are kind of like the root underlying causes you see with a lot of, I know this is obviously a very broad, expansive topic, but what are kind of some of those very common or maybe even not so talked about root causes of some of the diseases that you see patients for?
Yeah. So I would say gut health, like intestinal gut health. I think people are hearing that as buzzwords and getting familiar. There, that could mean 100 things, but there's a lot. Like our digestion is so important. We have more bacteria in our body than we actually are cells. That's kind of a creepy thing to think of, that we're actually more bacteria than human. I don't even like it's kind of
Crazy.
weird. And I'm not, I know out there it's so popular to do like a parasite cleanse or a gut healing thing. You can go deeper than that. That's still too generic for me. I don't want to just give a person a laxative and say, hey, great, you're cleaning yourself out, you're going to be great. That's where I'll maybe look at, have a person do an elimination diet or do food sensitivities. Or I do a lot of SIBO testing, which is small intestinal bacterial testing. We can do stool testing. That's where I'm a little maybe test heavy because I don't need a person just pooping like crazy. And, that doesn't always help them. So gut stuff is important. Stress is an underlying cause too. I mean, I think this day and age, everyone has a variety of stress. Just even good stress is stress. We all have stress. I will say perimenopause, hormone imbalance is and it's just going to happen eventually in that, when you're losing your eggs. So sometimes, again, that people think they're literally losing their mind because they have all these symptoms and they're like, something must be terribly wrong. And I'll say, it's probably because you're in perimenopause. And I'm like, I'll test hormones. I'll show them what I'm seeing and I'll even prove it. I'm like, test this month and test next month. And you look totally different because your hormones are changing up and down monthly, most likely in perimenopause.
Sure. So intestinal gut health, stress, obviously hormone imbalances, things like that, very common things that you see. And I feel like gut health just in general has been something that I feel like it more so in recent years has been talked about, and there obviously there's a lot that's not known about it too, right? It's very
Oh yeah.
neutralized, I think, compared to a lot of things out there. So, what are some things people, it's kind of a trendy topic now, but what are some things people can do to optimize their gut health?
So one, I would say every person eventually should try like an elimination diet or even just eating whole foods. We'll even just start with the simple basics, like get rid of processed food. Because that a lot of times if you're putting the wrong thing in, that bacteria can eat the wrong, it can react to certain things. I don't want people to be chronically dieting and chronically avoiding. I want to use it as a tool. So if a person, does even just picks out a diet and says, hey, I'm going to do vegan or I'm going to do paleo, I'm going to say, great, do it for a month and tell me how you feel. And then when they bring back food, I'm going to help them organize what that means. It doesn't mean that they're on that diet forever. And I think that's also something I see is people just get lured into a diet plan and think that this diet is for them forever. And I use it as it's a tool. It's not necessarily what you need to be doing. Use it as a tool and figure out if you're having issues with it. That's a cheap way to do it. And I used to be all about everyone needs a probiotic, and I will say I'm not that anymore because I think now we're over bacteriaed, and not like the probiotics are bad, but a lot of people have an overgrowth in bacteria, and that probiotic isn't doing anyone good if you're feeding the wrong thing, and if you're adding more bacteria to a situation that needs support. So either people are going to be deficient, imbalanced, or overgrowth. So that's a whole concept that, do you need to kill bacteria? Do you need to build bacteria? Do you need to balance bacteria?
Kind of along that same topic, I love this topic that, a lot of times if people don't consume foods for a very long time, they can, develop intolerances as well. Like, what is that kind of, do you recommend that people eat certain, like, especially growing up, do you recommend people eat and include certain food groups so they don't develop intolerances? And then how long, like, how does it work then in terms of like how long someone doesn't have something, then they could potentially develop an intolerance? I know that's a very broad topic, but what are kind of the core things that people should include in their diet to make sure at an earlier age to make sure they have as few intolerances as possible?
So I will say I'm going to change your question slightly
Go
to
for it.
make it
Go for
fit.
it. It's a better
I
question.
So there's a couple different thoughts. I think I'll answer the question this way. So I actually truly believe if you didn't eat gluten for 5 years and gluten was not a problem for you, you should be able to eat gluten again without problem. So I think it's kind of a false idea that people will develop intolerances from avoiding. Now, there's exceptions to that rule, but I've played with gluten many times. I've been off gluten for many years here and there. Sometimes I eat it. I've been off of it for lots of times. So with my daughter, when I was nursing, I had to be solely off of, eggs, gluten, dairy, all nuts. I had to be off beef for a while. I had to be off a lot. So I was off foods, let's just say multiple food items for 2 years straight. Couldn't cheat because she would have a reaction. So when I was eager, and at this point I'm like, oh my gosh, I can't wait to have food. Just, I don't know, you're a mom, you're like, darn it, I can't have anything. Anyway, so I was like, okay, when I'm done nursing, pizza's like one of my hidden like foods that I love, but I eat it healthy, but that would be my bad food that I like, right? Or is it even bad food? Anyway, that's a whole nother topic. But so I was gonna have pizza. That was my thing when I was done nursing. I was gonna go and get this margarita pizza at Roman Candle. So excited for it, and I ate it. And well, one, I realized it actually wasn't even that good. I haven't even had it since. So I was like, like I was like, my memory was like, oh my gosh, this is gonna be great. But then my taste, I was like, I don't know. Obviously it wasn't that good because I haven't ate it in 9 years. But I didn't have any reaction, didn't have any didn't have any rashes, joint pain, stomach pain. I wasn't gassy. I wasn't bloated. Literally, it would have been like I was eating what I've always done before. Now I've worked at elimination in the past, so you could argue that I've worked through those and I probably cleaned up my gut good enough that I am able to eat other foods without problem. And that's what I would say. If a person eliminates gluten, let's say for a year, let's say for a month, for 2 months, whatever it is, and they bring that food in and they don't feel well, whether it's a headache, stomach pain, joint pain, rash, that doesn't mean they became intolerant from avoiding it. Our body is able to break down, unless you have a different condition like pancreatic insufficiency. Our body should be able to break down that. Our body's not that dumb that it's just going to stop breaking. Our body breaks down macros, fat, protein, carb. Yes, it might have certain enzymes to break down deeper proteins, but really it all boils down to our body is made to break down protein with hydrochloric acid and pepsidase and amylase for carbs and lipase for fat. Our body knows how to break down macros. So whether it's gluten or gluten-free, it should know how to break it down. It just, again, when people have certain instances, certain proteins might be tough. Anyway, if a person brings that in and has a reaction, it's because their body hates them. I call it the slap in the face reaction. Our body loves to feel good, right? Even with weightlifting, if you lift the same, if you're doing 20 pounds for bicep curls for a year, it's going to feel super easy and it's not going to do anything for you because you become like immune to it. You become numb to it. It's not giving you much benefit because you're not building muscles. You're just doing the same old thing forever and ever. But if you up it to 25 pounds for bicep curls, you might be a little bit sore the next day, or you might sweat more. And is that a bad reaction? No, that's maybe a good like, ooh, I actually did something. So our body loves to be balanced. When we do something different, it either likes or doesn't like, or it's a change, our body might give us a little slap in the face and say, mm-mm-mm. So if you're getting a bad reaction after bringing in a food, your body doesn't like it. Like, it's not because you developed an intolerance. It's because your body truly doesn't like it. And you kind of were just maintaining this status quo before. Sorry,
Right.
that's a really long answer.
Oh, that's a pretty good answer, because I think this is a challenging topic to cover, right? Because I think there's the camp that, especially within recent years, who kind of like avoids everything. They're like, I don't want to taste or try anything that could potentially even be an intolerance. And then there's the camp that's just like kind of eat whatever. So obviously there's some sort of balance there.
Yes, and that's where I will agree that I don't think everyone in the world needs to go out just blindly avoiding stuff though either. I think a person should do a trial and error for like a month. I have patients that are fearful of eating food, which is not what you want. People can get eating disorders and because they're afraid of certain food categories, and that's not good. Believe me, I have a whole bunch of those people that I try to encourage food. In general, a person should hopefully be able to eat a wide variety of food. And I might have a few biases to a few items. I mean, again, I go in spurts where I eliminate things, but I mean, I have to cook special because of my daughter. So I'm not going to make big, glorious dairy meals. Like, we don't have much dairy at home. I'm fine with that. But it's not like I forbid my son to ever eat dairy because my daughter can't. He seems to do okay. So we'll buy organic dairy occasionally and he'll have it. So I do think if you can eat a wide variety, you get better nutrients, you get better profiles. So the goal would not be to be so strict and limited, only if you have to.
Right. I love that answer. That it's obviously very balanced and nuanced depending on the individual. And right, I think certain people do kind of hear a lot of the things out there and kind of become fearful of certain foods, like, oh my gosh, I heard this about gluten, or I heard this about dairy, so I'm just going to never ever have it, even though they could be perfectly fine to consume those things. So I agree that it is a little bit more nuanced than that. So I know we're running short on time here, and I want to make sure I get through one or two more things with you. So if someone right now like is following traditional medicine, like they're not getting results, like maybe they're taking medication for some sort of condition they're having and then it's not working, like why would you recommend naturopathic medicine to that person, and how would they go about getting started with using it?
Yeah. I just think we take time. Like most, I would say any alternative or, I mean, naturopathic doctors. I mean, my new patient appointment for a patient is 2 hours. We definitely don't spend 15 minutes. I'm not trying to put a band-aid on anything. I'm trying to find the root cause. So most doctors don't have time. A lot of insurance like organizes like, hey, you can only see a patient for this long. So I think that's the main problem partly is because no one has time. So, I mean, find a person that has time for you so they can dig deeper and try to figure things out. I think there's probably 100 ways to figure out your health. It's never one thing. It's usually multiple things. Um, I don't know if I answered that, but yeah,
Yeah.
people need time. People need time. People need to be heard. People need to investigate.
Right. So with naturopathic medicine, because it's not so driven by insurance companies, where it's like you have, obviously it's very business driven, right? We know how they operate. So, sometimes doctors are only able to see patients for a certain amount or for a certain period of time. Whereas obviously as a naturopathic practitioner, you can see people for much longer and do a lot of things that maybe traditional medicine wouldn't be able to do.
Yep. Eventually too, that we got licensed to be primary care doctors. I don't think it'll be in place till probably like March of 24, but we don't even know what that will entail yet. Like insurance companies might start accepting, but then you're still going to get people just like look at the chiropractors. Some are in network, some are out of network. Some people still go to the out of network or pay cash because they do something different and they can do different things. So like it'll be interesting to see how that piece goes. I don't even know what we're doing as a clinic or I mean, I want people to save money by all means, but like eventually you again work for that insurance company. And, if they tell me that, hey, they're only going to pay me for a 15-minute visit, how do I do that then? If I want to spend 2 hours like that, there's a problem there.
Yeah, no, I resonate with that and agree completely. So, if we can finish on, if someone's been listening to this and they are interested in going the naturopathic medicine route, so where can someone find out more about you and how can they get connected with you?
Yeah. So I work at the Family Clinic of Natural Medicine. We moved to Deerfield in February. So that would be a good spot to go to familynaturalmedicine.com. Just even for any naturopathic doctors in Wisconsin, there's the Wisconsin Naturopathic Doctors Association, and you can see every like licensable doctor in Wisconsin that is on that group. I help organize the conference there. So we have a good bunch of doctors. So there, of course, a lot more are scattered around the Madison type of area, but there are some up north people too. So, wherever people are, Zoom and virtual visits are a thing. I mean, I see people in different countries. So, I mean, you can always look if someone's super interested with a special niche, like look for any naturopathic doctor that maybe fits their need. Even if they're in another state.
Love it, love it. And I love how you brought that up about how you can see patients virtually as well. Because even if someone listening to this isn't in the Madison, Wisconsin area, you are still able to connect. And whether they can help you or not, I'm sure they'd point you in the right direction to make sure that you have the proper care that you need to treat. Like you've talked about this whole time, the underlying cause of things. Because if we just keep putting band-aids on things and giving medications, you're not necessarily fixing the actual problem. So I really love and appreciate everything that you talked about today. And I'm sure anyone who's listening to this will get a lot of value. So really appreciate your time today.
Yeah, yeah. I'm happy to talk and share my story and information.